So welcome. Today's session is the ABCs of the Primary Care Local Health Coalition. And what we will be covering is really the content and the context of what's happening within the primary care within the North Zone. Our goal today is really to share information and to provide you with information to seek clarity, to learn of what's happening, and to ask questions. After each presentation or each section of our presentation, our presenters will give you an opportunity to ask questions, or so you can actually come off mute once we identify you as raising your hand, or you can just chat into the chat box. We have two moderators, myself and Kelly Houle, who will be moderating the chat box throughout our presentation. So please feel free to just chat in your questions at any point. So the subjects we're covering today is really the background and context of why we're here and where we're going, the new developments in the North Zone, the what and the why, and then really our call to action. So we have an invitation at the end of our presentation. So here are our presenters, Samantha Semergrad, who's the Executive Director of the Grand Prairie and Bighorn Primary Care Networks, and Lisa Kemp, Manager of Primary Care within AHS. And this session is brought to you today on behalf of the North Zone Primary Care Committee. It's a partnership between all the 11 primary care networks, Alberta Health Services, and the Alberta Medical Association, and of course, Alberta Health, our funder. And our sponsors today are Dr. Helen Akilusulu and Greg Cummings, and you'll see their pictures here as a point of reference. So a little bit of context just to help ground us today. I'm not sure if everybody knows a little bit about the background of how the zone primary care came into being. So this is based on a ministerial order from Alberta Health. They actually created an order for the development and implementation of primary care committees in the zones, which is governed by the Provincial Primary Care Committee you see at the top there in the pink box. These groups report up to the minister and that department. Every zone actually has a zone committee. Each zone's committee is different in terms of its makeup and membership. For example, the North Zone has 11 primary care networks sitting at the table, and there's 11 primary care leads, physician leads, but not all the physician leads sit at the governance table. Actually, there's geographical representation from some of the PCNs and the physician leads. So there's one rep that covers, for example, Bonnyville, Cold Lake, and Lakeland that represents that geographical region, and they bring back to their physician colleagues. So at the North Zone governance, it's not all 11 PCN physicians that sit there. In contrast, the Edmonton Zone, as an example, all the 9 primary care leads sit at governance, and all their 9 executive directors sit at governance as well. In terms of the North Zone, we only have 2 executive directors who sit at the governance table, and they are non-voting members. And in addition to the PCN representation, we actually have Alberta Health Services and some of the senior operating officers representing certain geographical domains and areas like chronic disease, addiction, and mental health. So those senior operating officers are sitting at the table as well, and there's 4 of them. And then we have 2 public members that are part of governance as well. And then we have a support team, and the support team is a structure that really helps in terms of providing secretarial support for the governance group. And we have representation from the Alberta Medical Association, Alberta Health Services Primary Care, and the PCN as well, sitting as a support team to help the committee function. And really the role of the PCN committee from the zone's perspective is really to advise the provincial committee on policy and strategy. And the actual networks themselves are what has the input up to the committees. So it's just a little bit of background there. And then you'll see on the pictorial here that as an offshoot of the provincial PCN committee, there are these task groups that are really domain specific, working on specific elements. For example, the chronic disease, there's the zone service planning, evaluation of PCNs, primary care, access and continuity. So you'll see that on that graphic there. So one of the key deliverables for the zone committees is something that was brand new last year, is the zone service plan. So this is a new endeavor, a new objective from Alberta Health, that every zone had to deliver a zone service plan, working together in partnership with PCNs and Alberta Health Services and the community to develop a zone-wide service plan. So we started this work last year. You can see by this picture here, the timeline. It started in April, and we had a deadline of September to submit a zone-wide service plan. So for the North Zone, we actually met our deadline and submitted a zone-wide service plan, which is a high-level strategic document. Just so you know, it was finally approved in the fall. We submitted in the fall and it was approved in February of 2020. And now we're at the stage where we need to implement that 3-year plan. We're in our first year of implementation. The document is a high-level strategy document in terms of priority areas. It does not tell us exactly the how, and this is part of our conversation today of what we're presenting. And just so you're aware, the North Zone has to align to objectives set by the Alberta Health Service, Alberta Health. Alignment, integration, and shared services is one of the key objectives for Alberta Health in terms of primary health care and primary care. So our service plan zone priority areas, chronic disease and comorbid conditions, addiction and mental health, frail, complex seniors, maternal child, Indigenous health, and vulnerable and unattached. We started off with these high-level areas as directed by the Zone Governance Committee to start to look at gaps and needs in the zone. We set up 3 working groups in addiction and mental health, chronic disease, and transitions of care to look at what we could put into our zone service plan for submission. And then when we submitted our zone service plan, we were fairly broad in what we wanted to accomplish in our first year in terms of implementation. And here are some of the highlights. Transitions of care was one area that we wanted to focus on, looking at a pilot potentially with home to hospital to home, the guidelines that are coming out provincially. Looking specifically at unattached and vulnerable, we have in the North Zone a high population of unattached patients who do not have a family physician. The navigation support, that was a key theme that came out of our service planning. Difficulty in finding out what resources are available, not knowing what's in the zone, who's offering it, where the gaps may lie. So a lot of navigation support came out in the themes. And in terms of integration and alignment, really looking at capacity building in terms of addiction and mental health, building understanding awareness of patients' medical home and the provincial projects that are out in the community, like this pathway work that's happening provincially from the SCNs. I'm getting a message here that I'm cutting out, so I just want to do a little check here. If somebody can just chat in if I'm still cutting out.
I think you're good now, Ping.
Okay, thank you. Great, sorry, I just got a message that not everybody's hearing me cut out, so thank you for that. So just going to move on. So realize this was a very quick high-level summary of zone service planning, and I'm seeing the individual names that are on today's call, that some of you have been involved when we've done other sessions, so thank you very much for coming to join us today. But this is very quick. It wasn't intended to really deep dive into zone service planning. We really want to spend some time covering the next sections, and that's where we'll give you a lot more opportunity to engage with us. But at this point, I just wanted to pause and see if there was any questions at this stage. If you want to just raise your hand if you do, or chat in. Great, I'm not seeing any questions come across, so we're gonna just move on, and I'm just going to introduce our next speaker. Just hang on 2 seconds, I'm going to advance the slide. So really today, we wanted to cover our implementation. What are our plans for implementation? Really, this is the meat of why we're here today. With any planning, and I'm sure lots of you on the call are familiar, you do a lot of planning, a lot of effort goes into planning, but we don't get to implementation. And really, this is critical for the North Zone to meet the objectives of Alberta Health. We want to get to implementation. And how do we accomplish this in the North Zone with its large geographical expanse? What really needs to be in place to be successful given the partnerships and the expectations? So this is the solution, the problem that we're trying to solve with what we're going to present next. So I'll introduce Lisa. And she will cover the North Zone Primary Care organizational structure.
Can you hear me all right?
Yep. Go ahead,
Super.
Lisa.
Good. All right. So this slide here is a visual depiction of where the service planning work began on the left side and then where we're headed on the right. Ping had referenced the structures that support this work. And on the left, you'll see the 3 circles there with the 3 groupings for addiction, mental health, working group, chronic and comorbid, and transitions. And those were more grouped by subject matter expertise and kind of got us started. On the right side, what you'll see instead of those 3 subject matter groupings is a new structure called a Zone Integrated Operational Strategy and Leadership Team, and or the Integrated Ops Team. And that is a way for us to ensure we have primary care network representation, Alberta Health Services continuum care representation, and then of course our project manager, Ping, who is common to a lot of different structures of work that all kind of align. And so there's better coordination and communication at that level. Below that, you'll see there's 6 local health neighborhood cohorts. And as Ping referenced, the North Zone is huge. It's very diverse. And while there's common asks and deliverables, there are unique features to each area. So how do you tackle this? Well, we wanted to break it down into smaller areas. And so that's basically what we're going to be talking about today. Next slide, yeah.
And so what is a primary care integrated ops team? So we know that the implementation of service planning is going to require strong support. And as Lisa described, we're triad leadership between Primary Care Networks, myself, Alberta Health Services, which is Lisa, and Ping, our project manager. So we see ourselves as the backbone support needed to coordinate, communicate, and facilitate service planning. We help co-design and plan future service plans, and the aim is to be a forum to help develop action groups and health neighborhoods. And so what are we not? So we are not an authority group or an approval group. So the authority and approval actually comes from the North Zone PCN committee. We are not a formal entity, but we are a way to support and organize the work. And of course, there's never any additional funding or resources. So we're looking for as many volunteers as possible.
So how are we going to implement the service plan? We will be doing that through the local health neighborhood coalitions. Back in December of 2019 and January of 2020, just before submission of the North Zone Service Plan, we conducted some engagement sessions. There were a total of 5 of them to discuss service planning. And it was really apparent at that time, there was a lot of passion and interest to involve local operational individuals so that we could co-design services that meet the unique local population needs. And so that basically is why the local health neighborhood cohorts are being developed so that we can move forward to the next step. There will be a total of 6 that will be developed over the next 2 to 3 years. And we want to make sure that we have as many local operational on the ground people as possible to do this work. Next slide. Go ahead, Sam. I think you might be on mute.
Sorry, I'm chatting away and I'm on mute. Thanks, Lisa. So this is our overarching vision for Local Health Neighborhood Coalition. And so this vision statement is also the statement for primary care transformation. And you'll also see it included as part of our terms of reference. And so the primary healthcare system supports improving the health of all Albertans by ensuring that individuals, their families, and caregivers are at the center of team-based and integrated health and social services at the community level. And so some of the objectives of the Local Health Neighborhood Coalition, so meet the goals and improvements in primary care, act as mechanisms of change and action, implementation and action planning of the zone priority activities, and a collaborative model that can be sustained.
And next slide.
Sorry, I just heard Sam cut out. Hang on a second.
Oh,
Yeah,
sorry. Technology.
So Sam, are you still there?
Yeah, I'm here.
Okay, so I'm not sure if you covered this slide.
So the expectations of Local Health Neighborhood Coalition. So the idea is that this will be led by local co-chairs and leaders, a dynamic group that will be nimble and action oriented. And we want, of course, the members to grow and change depending on the different activities. So members will also have the ability to make decisions for local implementation, and the main coalition may have offshoot groups addressing on specific activities. So the idea is that we'll be working from a common agenda as part of the zone service plan priorities.
Okay, Lisa, you have anything to add on this slide?
No, nothing to add on that one. Thank you. And so this here is just an enlarged version of the visual that was presented earlier. And it just gives you an idea as to the group, how the local health neighborhoods will be set up. Because of the diversity and the vastness of the North Zone, it's been divided to try and get it into smaller bites, which are still, of course, big bites. So, and due to a variety of reasons, different levels of involvement in the works thus far and leadership changes, we actually have selected a pilot to our first one to begin in the LHN1, which is Grand Prairie, Peace Region, Saddle Hills, and the surrounding communities. So it's obviously a very lofty goal to have 6 of these established in total. So we want to start there and kind of learn and grow from there. We understand that there'll be some nimbleness because based on different levels of engagement, logical ways that other work might align nicely with this. And so that again is a bit flexible. But targeting to start with, to start getting set up in the fall. And then hoping to spread out by the end of 2021. And we have a draft terms of reference just sort of as a foundation. And as the local areas or local coalitions are developed, they will build on that as well.
So the key messages. So this is a different approach to achieve the implementation of the zone primary care service plan. There's going to be growing pains just like anything else, but we want to attempt to be creative and resourceful. Of course, we're going to expect to encounter barriers and challenges. And we know that change is difficult, but we also know that change cannot occur without relationships. So care is a continuum, and solid working relationship and partnerships can support and facilitate an integrated model of care that benefits everybody. So if there's anything you kind of take from today, these are kind of the key messages. So we believe that the health neighborhoods may be the way forward to meet the vision and the goals. And so, which are shifting the focus from hospital or acute to community-based care closer to home, planning healthcare with people and communities, improving continuity of care and system navigation, empowering people to be active partners, and integrate healthcare with other public services to form a system that links Albertans with agencies that address the social determinants of health. And so I want to give you a little bit of a story or scenario to kind of give you an idea of how a local health neighborhood may work. And so remember, it's not just PCNs or AHS that form the health neighborhoods. There are a vast number of people around that table. And so community services, municipalities, patients, citizens, of course, and that's just to name a few. So we all come together and we all discover we have the same problem. We've heard accounts from people in our organizations or within the community that finding information on programs or services is hard, and we've all been there. There's so much information and so many things available. It's hard to know exactly where to send people when they ask questions. And although we primarily focus on healthcare for service planning, we know the issues we have aren't just limited to healthcare. So think about a person who is experiencing maybe mild depression, so they need some mental health support. At the same time, they've lost their job, so there's financial stress. They have a spouse who has diabetes and their family can't cope. And so most of us have kind of been privy to this scenario in our work. And they see their family physician who tries to refer them to programs and services. And most times the physicians does not have all the information to provide on what is available and who. It takes kind of a lot of work to figure out all the different moving parts for that patient. So does AHS provide all the applicable programs? Does PCNs have something? Some do, some don't. What is available out there for other community supports? So searching out what is available and most appropriate can be overwhelming, as this particular issue with this patient is not solely on a mental health condition. So from a person-centered care perspective, we not only need to address the clinical needs, but we also have to address the social ones as well. There's so much out there, but not knowing what, where, and how to access when and who provides is something we think is a problem. And I think that you'll all agree. And it can be approached with all of us working together to collect, consolidate, and centralize for the North Zone into a single resource tool. So we think that this could be a tool that can support navigation and create clarity, but obviously the real outcome is the collaborative working relationships and doing this differently. So perhaps in the future, beyond the first year of this service plan priorities, this type of work and product or tool can help us look at duplication in programs and services and putting very limited dollars in health and community social services to different and creative plans. Next slide.
Thanks. So just backing up, we have, again, done the 5 engagement sessions in the past and seen some real keen interest, familiar themes that, as Ping mentioned, we're not really great at implementation, and we don't really, there's not that ability to have a say at that local level. So we're pretty excited about this opportunity. So today's about you having the background to know kind of how we got here and where we're headed, and it's really a call out for participation, and we'll be looking for co-chairs for our first local health neighborhood coalition, and looking for specific criteria for you to join us so that we can get the work done in a co-designed effort and know that the diverse players in the healthcare system are all represented. I did want to just add that there are pockets and examples of these health coalitions here and there and everywhere that are doing really great work and have seen, results, which is, another reason why we thought this was a good foundation to tackle the work. And some of you guys might be familiar with them. Youth mental health hubs that have gotten together, and Alberta Health Services and PCNs thought they knew what each other was offering, but weren't maybe aware entirely. Community resources been pulled in, and just finding new ways of meeting the needs of the patients and their families in a more seamless and integrated way. So we're pretty excited about this. So who are we looking for? Well, there's some common traits, obviously, that we would want to be looking for. We want people that represent that local geographic area, people that have an interest in health service planning, probably operational on the ground people, people that understand we have deliverables to meet, we have common interests for the common population. So that would obviously be before your own personal agenda, and wanting people that can make decisions at a local level. The co-chair, we're hoping, will have a strong ability to foster and build relationships and have great communication skills, of course. And in terms of anyone being a member of a coalition, obviously there's an expectation of commitment, attendance, being action oriented, and very dedicated to implementation. So we're hoping to get your interest today, hoping that you will see enough in here that you might know some other individuals who are not on the call and can spread the word for us and be a part of this exciting work. So the next stage is we want to make sure that we're selecting some co-chairs from the local geographic area that we spoke of earlier. Circling back to individuals who participated in the engagement sessions, because again, we had a lot of really great engagement there. We want to set up some meet and greets, knowing that everybody wants to, we want to build relationships. We want to leverage ones that exist and build on them, start new ones, and really build on that network. And as I mentioned before, the timelines for implementation are going to be flexible, just depending on those levels of engagement and how it might align with other work.
So wondering, we've given you a little bit of information or a lot of information in the context, and if there's any questions, please raise your hand if you do have a question or chat in. And this is your opportunity. Our formal presentation is done, and just want to have this opportunity to address any questions, get some clarity, provide you if we haven't addressed what you wanted to find out today. So this is your opportunity. I'm not seeing any hands or chatting, so is it crystal clear? You'll see let's see. So the question is, I'm wondering how often everybody would be meeting. Great question, thank you for that. In terms of the first pilot coalition, in the beginning, I think the expectation would be to meet every couple of weeks, just to get to know each other, to find out what the purpose is, what's the responsibilities, the roles. So I think in the beginning, these coalitions would need to start to have a little bit more frequent meetings to form and be successful. And then obviously in terms of the membership and the co-chairs, having that conversation on the frequency of those meetings would be part of the terms of reference. As Lisa mentioned, the terms of reference, or Samantha mentioned, the terms of reference is drafted, but it really is only 80–90%, leaving a capacity for the coalition and its membership to really develop the final terms of reference. And so the first couple of meetings would be probably involving the terms of reference and the conversations happening and determining that frequency that makes sense. But I think to build relationships, you would probably most likely meet a little bit more frequently in the beginning. So hopefully that helps answer that question. Samantha or Lisa, anything to add?
Just I think that, Lisa and Ping and myself will obviously support each of those groups. And our plan would be to also host kind of a meet and greet to try and get the groups going.
Great.
Yeah,
Lisa?
I would just add to that I think you might be doing some work where you feel like this model would serve as a really good foundation for that. So we're happy to support, getting different groups started at different times. You don't want to sort of wait your turn to be tapped on the shoulder if there's some great work underway that could benefit from setting up a health coalition. Again, nimble membership, ability to sort of grow and change given the subject matter. And that's kind of what's exciting about this work, is that you're not signing on a dotted line for 10 years indefinitely. It can grow and change, and great opportunity to mentor other people and get them involved in this type of work. So
Great.
lots of different options. Yep.
And there's another question about, we finding members and co-chairs for the first area only? So I think we just to expand a little bit. We have intentions to start with the Grand Prairie Saddle Hills Peace area. We know it's a very large geography, but there's a lot of services and programs that kind of go into the same area. So and utilize have the same partnerships in terms of community agencies, things like that. So that's the first area, but doesn't mean we're going to be limited in thinking about membership or co-chairs for the other geographical areas if there's lots of passion and interest. Hence why these meet and greet sessions might be an alternative. If we don't formally build a coalition in another area, it doesn't mean that you can't start building relationships. But if there's high interest and really great leadership in terms of having co-chairs step up, we could probably start another coalition as well in another area if there's interest. So we're certainly not stuck to the plan, and we want to be, as everybody's mentioned, adaptable if there's really good interest. So there's I'm going to move the next slide. There's another slide that's not this one, but this one right here. Is that the right one? So there's a comment about very happy to support this work in whatever capacity. Well, thank you. That's great. Excellent. We'll be reaching out. And is this a slide that was requested? Okay. Any questions on this slide? Now this isn't, these are just bullet points for the slide deck. We actually do have an invitation document ready to go to send out to the participants today on inviting you to be members of the coalition. So it gives you a little bit more detail in that document. So this slide is just really high level. So another question, how many members are we looking for in each area? Lisa, Samantha, you want to start, or you want me to just chime in?
I think often they always say, groups of 5 to 7 work well together, but I don't know, we know we're going to go with a core group and then branch out from there with different working groups or how that might work. I've seen a lot of different models, but I think what's most important is ensuring we have the diversity. So not just folks from health services within AHS, but also within the PCNs and our community resources. And in addition, we want to have patients and families in participation. So, so we have to sort of gauge how that will all work together. So I think that's flexible.
Yeah, and I think we'll learn from the first neighborhood to kind of go live, which is the Grand Prairie Saddle Hills piece. We'll be able to use that to figure out kind of where the sweet spot is. But also, like Lisa mentioned, there's going to be offshoot to your local health neighborhood coalition. So that might be working on specific things that, you know, we could potentially broaden the group. So this is brand new. And so it's going to be trial and error. And we just want people who are motivated and, you know, want to advocate for change to be a part of this work.
And then I'm going to add that the numbers are not defined because that's something that each coalition will ultimately determine. But 5 and 7 is a little low in terms of the geography here and the number of organizations. So I just want to clarify that it probably will be bigger, but it's going to be an ebb and flow of membership through time. And you'll see with the terms of reference, which we can certainly send out as well, for reference for this group, is that there will be core members for the committee, there will be ad hoc members and others. So there's different levels of involvement depending on what the coalition is actually working on. During the first part where there's development, and we actually do have priorities set of what we want to achieve this year, it doesn't mean that other things aren't on the table for action planning, and then you might have other members come and join. So that ebb and flow of activity or membership is really depending on what the coalition's doing at the time. So it could be anywhere from 5 doing little bits of work to up to 20, 30, depending on what's the coalition is actually involved in. So, and that's going to be part of the co-chair's responsibility to really help guide and inform with the support of the integrated ops team. The expectation is that co-chairs will be that conduit back to the integrated ops team to just keep us apprised of what's happening, and we would be part of the support mechanism if there's anything that we need to do behind the scenes to support that coalition. We will definitely share the slide deck out with everybody afterwards. Just so you're aware, because this is being recorded, we will be posting the recording somewhere. We haven't quite determined where it would sit, but this recording will be available after as well. Any other questions? We have about 15 minutes left.
I think I just wanted to point out as well that these health neighborhood coalitions are not groups of high-level management. We want this to be action-oriented with staff that know the system, that are on the ground. So I think that's an important point to make. What we don't envision this being is a group of very high-level strategic people. Because that's not going to get us kind of the change that we're looking for or the work that we want accomplished.
Thanks, Samantha, for highlighting that. So any other questions? I'm just going to do a quick, I'm not going to pull a poll up, but if on your, if you click on the participant icon on your menu bar, you'll see on the bottom of the listing of all the participants some icons, yes, no. If I ask you, was this informative? Did it help clear anything? Answer yes or no, please. Excellent, thank you. And my other question is, would you be interested in sharing this information out to others so we can spread the information about membership and participation? So if you, I'm just going to clear it all, and if you don't mind answering yes or no. Great, thank you. And then another question for me, this is not a yes or no response, but if you can just type in or come off mute and answer. the documents we're sharing, so I have 3 things we're going to share with you: the slide deck, the terms of reference, and the invitation for membership. Is there anything based on our presentation today that you think is missing that we should develop, that we can help spread this around? So if you don't mind chatting it in or coming off mute. Okay, there's no other things that we need to develop to get the word out. The question about the service plan, yes, absolutely, we can share that out as well. The approved version, yeah. I'm just wondering, Samantha, maybe, yeah, we gotta figure out where we post some of the stuff. So
Yeah, we can come up with some places to post, and if anyone has any suggestions, Ping, I think you have an email attached to this slide deck, don't you, where people can email in?
yes, yeah, yeah. I'll get to that.
So if you do have suggestions of where you think it might be a good place to post, please let us know.
So are there any other questions? I will give everybody an opportunity to ask any burning questions now. Okay, if there are none, I just want to let you know that if you do think of anything after you receive some of the documents or it comes up, certainly this is the contact information for the integrated ops team, Primary Care North Zone at outlook.com. And this is where you can send in your questions if you think of questions after the fact. Oh, I see another question here. So the question here is that you mentioned people involved other than people employed. How would they see the information? Sorry, if you can just elaborate the information. You mean the documents I'm sharing? If you don't mind just elaborating, if you want to come off mute, that'd be fantastic.
Hello?
Hi, go ahead.
So, I am new, so bear with me. As you're mentioning all this stuff and you're mentioning the collaboration members, I understand that it's not just people who are employed with Alberta Health or PCNs or nurses, that you're looking at people within the communities also, but how would they know about this? And then how would they find information to say, hey, I'm interested?
Great question, thanks. So with anything in terms of the work we do, is really built on the relationships, and we're dealing with so many different organizations and different walks of life and people. So one of the asks that we have is that you spread the word through your networks. We certainly have spread the word through our network. So if we're thinking about patients and families, I've already reached out to send information out to the patient advisors within AHS, but also externally to AHS. The health advisory councils. We're trying to spread the word as much as possible. Unfortunately, we don't have one single site that would we can send to anybody to right now for the North Zone, but we'll post it on multiple sites where we can. So the primary care networks have their websites. AHS, we're going to try and get access to the AHS site to post things on the Primary Healthcare Integration Network link, which is on their website. So there's multiple fashions, and then certainly with your community partners, if you have working relationships, spread the word that way. So we're really relying on the individuals who attended today, plus all our natural relationships to help to build that momentum to spread the word. And that's really kind of the organic way to do it. And again, it's information where people want to see it, and we'll link in if they're interested. But it's having that relationship, saying, hey, this is something that's really important. This is interesting. Do you mind taking a look at the information we're sharing or that you're sharing? So that kind of is a point. We're trying to utilize your existing relationships. Samantha, Lisa, any comments?
No.
I think the only thing I would add is that it's really important that we're leveraging engaged individuals who are really passionate about the work. And what we have seen in the past is that the smaller coalitions that we've kind of observed is those were the ones that always took off and got traction and momentum, right? They'd tackle something and from there people would say, wow, that was, we did really great work. What are we working on next? We'd bringing in and out subject matter people. And it was just interesting to watch how it sort of grew and then the word would go out from there. So we're anticipating that there'll be some of that organic piece, even though we want to ensure we've got structures in place to ensure the diversity is represented. So again, flexible and sort of an experiment. And if anybody wants to tuck and roll and come along for the journey with us, I think it's a new way of doing things. We haven't done this work like this before on a larger scale and formalize those relationships. So I think it's really exciting work to be a part of, and can't wait to meet everybody and see how it all rolls.
Yeah, and I echo everything Lisa says.
So just another thing, we did do some more formal mechanisms of communication. So the dyads, Helen and Greg, sent out a memo within primary care and AHS through the zone committee that was supposed to be cascaded down from everybody, from the committee to everybody who sits on the committee to all the direct reports and people report up. So that's AHS and PCNs, but also we have spread it out. I think Kelly's on the call. She's spread it out to community agencies and people we're connected to. So there's other ways that we're doing that. We're more formal announcements, but certainly it's not. This is one way of it, having an information session to really gather more feedback on how we should share out. And then the comment here about a same question, a one pager with general overview to share would be helpful. Absolutely. I think we have something. Might not be as suitable in terms of general lay terms, but we will create something if it doesn't meet the needs. So you received the glossary in advance of today, just to give you some of the terminology. So we'll probably do something similar with the one pager. So great, we will send that out as well. So looking at our time, any final questions? Okay, so Lisa, I'll go to you, final comments. Oh, I see another question. Sorry, I apologize.
Oh, go ahead.
Yeah, we're just monitoring the chat.
For sure.
So how will we receive updates on the development? You guys want to tackle that, or you want me to tackle it?
I think it's a good question to start with, and yeah, I think you're right. We don't necessarily know where that one place is for information and how we might disseminate, but looking for ideas too. I don't know, Ping, you might have had some thought to that.
Yeah, I'll just go to Samantha. Samantha to.
Yeah, I just think, that remember that this is a different approach. We're kind of excited about it. We know that there's going to be growing pains, and really look forward to having some action-oriented colleagues and community members to help us kind of get going and making this real for service planning.
So I just want to answer the question. So you're here today because of the cascading mechanisms we have in place for communication currently. So we will still utilize that mechanism, which is if you're within the PCN world, it's through your executive directors or your physician leads. If you're in HS, it's through their communication mechanisms. from their senior leaders and down, cascading. So that's one way. So you would have received the information for this session based on that. So we will continue that, but we will have formal updates on the development of these coalitions as part of our communication plan. Status updates, where we're at, whether that's going to be flashy newsletters or things like that is yet to be determined, but certainly if you found these information sessions valuable, if you found this information session valuable, if you can just put yes into the checkbox, and then we will put that into the plan going forward, that we would continue doing this, because it's really about us having everybody involved and understanding and collaborating with us to do this work. It cannot be a top-down approach, and for the work of zone service planning, the expectation is collaboration. We use the word a lot, but we don't really know what that truly means in terms of actually getting to implementation. And this is our go forward and trying to develop I really saw a strong evidence of collaboration from primary care in the North Zone between all organizations. So we really will endeavor to try and do these sessions on a go-forward basis, in addition to the other mechanisms that are already in place in the zone. So I hope that answers your question. So I'm seeing some check boxes for these sessions to continue. So certainly thank you for that. Okay, Samantha, final comments from you before we sign off.
I just look forward to working with you, and we hope that you're able to share our information, and as many of you join some of our local health neighborhoods.
Lisa?
Same. Again, I think it's innovative, a new way of doing things. I've seen some really great things happen, surprises everywhere of people that, you know, didn't know about each other's services, didn't know who was who in the zoo. And by doing that, we can only go forward from here. So it's exciting to be doing rather than all the planning and all that prep and all that formal stuff. It's very, I look forward to that doing part. So.
Great, thanks, Lisa.
Yeah.
And just want to say thank you very much to everybody who spent the hour with us this morning. I really appreciate it. This is the first time we've done it this way, given our new world, virtual world, and really going forward, the coalitions will be starting in the virtual world for the next little bit. So we'll see how that goes as we learn to do this work collaboratively via the virtual platforms that we have. But stay safe, and thank you so much for joining today, and appreciate your time.
Thanks,
Everybody. Thanks.